My name is Anwar Al-Zaraini. I'm a co-founder of Privail, and we are developing point-of-care diagnostics for the early detection and monitoring of infectious diseases with an initial focus on HIV. Now, we all know HIV is a huge global problem, but for us, this is personal. My co-founding partner, Chris, lost both of his parents to HIV due to one very large problem, and that is the lack of early disease identification and treatment. Today, over 54% of people who live with HIV are unaware of their disease status until symptoms begin to show. And as a result, they are 11 times more likely to die within their first year of infection. And these individuals are not receiving early diagnosis due to several barriers, which include technological limitations and high costs. And when we look at the role that current diagnostics play during the progression of HIV, as shown by, as shown by this graph, we see that affordable diagnostics test far too late, whereas those that can test early are too expensive, And then anything in between essentially is just too low in terms of sensitivity and standardization. Yet it is critical that these individuals get tested early because only then can they go about receiving earlier treatment and enhancing their health outcomes for the future. And Privail is doing just that by providing low-cost diagnostics that can detect early and they can detect the virus itself. And we're doing this by developing specialized nanomaterials that can directly and specifically bind the virus. And these materials are able to emit a vivid color output. So in our case, in the absence of HIV, the test will emit a red color, whereas in its presence, it will emit a blue color. And we're integrating this technology into a low-cost portable device, as such, that's similar to a diabetic test, where all that's needed is a small amount of blood from a finger prick, and within minutes, a patient will have easy-to-read results in the form of a color or digital output. And we're making this happen. Privail is in its early stages of R&D, and we have patent-pending technology. And essentially, we're currently fundraising in order to achieve the milestones needed to have initial sales by 2017. And the beauty of our technology is that it's a platform. And so it is easily adaptable for the detection of a variety of infectious diseases. And so there's huge potential here to truly impact the lives of millions of people worldwide. And this is the team that's making it happen. We are a group of scientists and engineers from UC Berkeley and UCSF, and we came together to increase healthcare access to those who need it most. Those such as Chris's parents, or the millions before them who simply found out too late. So we're here to provide the right information at the right time and begin saving lives. Thank you.
Thank you. That's always a problem, the clicker. Have you talked to Naveen? If he develops the cure, he's going to put you out of business.
Oh, yeah?
Okay, let's start with Nina.
So three questions. First one is, tell me a little bit about the evidence that intervening earlier by a matter of days or a couple of weeks makes a difference in outcomes. Question two, what % of those small blood samples have enough viral content to be able to detect? Have enough what content? Viral content to be able to detect. And third, what's your expected cost of goods for the test?
So to answer your first question about the proof that early detection is important, right now there's a lot of research and a lot of therapeutics that are currently out there and being tested in trials that show that the disease can functionally be cured. People can live normal lives as if it's nothing. Pop a pill a day and you can live a normal life with HIV. The only catch is that the treatment needs to be initiated early. And by early, we're talking within the first 2 to 3 weeks. That's the answer number one. Number two, in terms of the blood sample that is required, it's no more than 20 microliters, and the amount of blood depends on the type of test that's being used. And so right now, the most effective tests can detect anywhere from 50 to 100 copies of the virus, and ours will fall within that range of around 100. And so that is for early testing. Whereas later down the line, for the later and lower cost testing, that's completely dependent on the antibody response, and that takes time. And then in terms of cost of goods sold, each one of these will be less than $2.
Yeah, I just have a quick question. So it's interesting because we're seeing a lot of sort of these platform models, right, where you're going to market with one disease and then you're sort of able to. What kind of predictability do you have? I mean, you've got sensitivity research that you have to do that you can actually model this in other infectious diseases.
Well, the technique that we're using and the proprietary materials that we're developing are actually very low cost and easy to manipulate. So that's not a problem at all. We just need to find something that can bind the virus, put it into our concoction, and then we're good to go. And this can be done in 1 or 2 days.
Nice presentation.
Thank you.
The one quick question, how long does it take and how much capital do you need to get finished with the development and be able to run a trial and get to what's my false negative rate?
2 million to get to the point where we're ready to start testing clinical samples.
And how long is the trial?
How long is a trial? No more than, I would say, a year to 18 months max.
Okay. And how much does that whole framework cost you, do you think?
That would probably add on another million or two, but we see it as being a very rapid process because the materials that we're using are very benign, and this has been done before. There is currently an HIV over-the-counter self-test that has a lot more limitations, but basically they've paved the path already, and so we're just following in those footsteps in terms of the regulatory process.
Thank you.
Yeah.
This one a shot. Hey, there we go. Yeah, I really like your approach to tackling the world's hardest problems. I'm a big fan of that. Along those lines, where are you starting? Who are your first customers? You know, there's a lot of markets to tackle. It's essentially an extension of John's question. What's
Thank
first?
you. That's a good question. So we've done a lot of groundwork. We've laid a lot of groundwork to be able to know how we're going to penetrate the market. So my previous company is called Rides for Lives, and what we've done is able to build mobile hospitals. These are buses that are hospitals that we take into rural areas, and we work out of East Africa at the moment. We have thousands of people coming through detecting different viruses and you know, HIV and malaria and all those things. So from doing that work, just to be able to get the hospitals into the space, we've laid a lot of ground. So we're going to do, you know, Africa, developing world, India side, and then we do the CE mark, and then continue this side with the FDA.
Who's going to be paying you?
So the customer is the individual. So our plan is to get it to a size like this, where you can be able to go and buy it from, you know, Walgreens or some store, CVS. But we can use the assay for lab experimentation, so that's a market, and just being able to buy it.
All right.
Great. Thank you.
Thanks, guys. Prevail.